female reproductive system has these main parts. Uterus where the baby grows. Ovaries produce eggs and hormones. Fallopian tubes carry the egg. Cervix lower narrow part of uterus. Vagina birth canal. Every month, the inner lining of the uterus becomes thick to prepare for pregnancy. If pregnancy does not happen, this lining sheds rightward arrow periods. Adenomyosis. What happens? Endometrial tissue grows inside the muscle layer of the uterus. Results: heavy bleeding, painful periods, enlarged, tender uterus. Easy trick. Adeno equals goes inside. Exam points. Common in women who had multiple pregnancies. Big uterus. Pain plus heavy bleeding together. Cervical incompetence. Normal, cervix stays closed during pregnancy. Problem, cervix opens early without pain rightward arrow pregnancy loss. Features: painless opening. Repeated miscarriages. Treatment, stitch in cervix. Exam trick. Painless abortion equals cervical incompetence. Dysmenorrhea. Types: primary. No disease. Due to hormones. Common in young girls. Secondary. Due to disease. Exam points. Primary rightward arrow starts early. Secondary rightward arrow starts later. Endometriosis. What happens? Endometrial tissue grows outside the uterus. Common places: ovary, fallopian tubes, pelvis. Symptoms: severe pain, infertility, pain during sex. Special: ovary cyst equals chocolate cyst. Exam trick: 3Ds. Dysmenorrhea, dyspareunia, difficulty getting pregnant. Fibroids. What are they? Non-cancerous tumors of uterus muscle. Symptoms: heavy bleeding, pressure in abdomen, sometimes infertility. Types: intramural, submucosal, subserosal. Exam points. Most common benign tumor of uterus. Depends on estrogen. Menopause. Definition: no periods for 12 months. Age: 45 to 55 years. Cause: ovaries stop making estrogen. Symptoms: hot flashes, mood changes, vaginal dryness, weak bones. Exam point. FSH upward arrow, estrogen downward arrow. Pelvic inflammatory disease. What happens? Infection travels from vagina to uterus and tubes. Common cause: STDs. Symptoms: lower abdominal pain, fever, vaginal discharge, pain when cervix is moved. Complications: infertility, ectopic pregnancy. Exam trick: young sexually active woman plus pelvic pain equals PID. Polycystic ovary syndrome. What happens? Hormonal imbalance. Features: irregular periods, excess hair growth, weight gain, acne, infertility. Hormones: androgen upward arrow, LH upward arrow. Exam trick: PCOS equals period problem plus cosmetic problem plus obesity. Prolapse. What happens? Pelvic organs come down from their normal position. Types: uterine prolapse, cystocele, rectocele. Cause: multiple normal deliveries, weak pelvic muscles. Symptoms: feeling of something coming out, urinary problems. Exam point: older woman plus many deliveries plus mass coming out. Vulvovaginal candidiasis. Cause: fungal infection. Symptoms: severe itching, thick white discharge. Usually no bad smell. Risk factors: diabetes, antibiotics, pregnancy. Exam trick: white cottage cheese discharge equals candida.